So I'd like to call this meeting to order and approval of tonight's agenda. I would entertain a resolution.
Not in though.
Okay,
There's you.
so Rita Curran, seconded by Nicole Terminelli and Mr. Lightfoot. All those in favor signify by saying aye.
Aye.
Opposed? Carried. I'd like a resolution for approval of the minutes of March 30th. Rita Curran, second by Mr. Perkins. Okay. Any discussion about the minutes? All those in favor signify by saying aye.
Aye.
Opposed? Motion carried. So tonight, first up is that we have a program from about opioid treatment. We have John Wilson, the Executive Director of Credo Community Center for Treatment of Addiction. Welcome, John. How are you? Nice. Okay.
You also have Karen White. She's our Director of Outpatient Services on the call as well.
Hi, Karen. Welcome.
Hi, thanks for having me.
I'm going to go into yours.
So initially, we were talking about having another entity come and actually make a presentation. Then we found out that they actually had never run a clinic. And I think Credo has been running a clinic for, is it almost 2 years, John?
Yes, we started in August of 16.
Okay. So this is an opportunity to hear about what the clinic does in Watertown, and we can ask lots of questions based on what their experiences are. So John, if you would, go ahead, please.
Yeah, so we started our clinic. We started the prep of it in early 16, and then hired our medical director to come on full time, partly in our OTP, and then in our integrated outpatient services in July of that year. And we started bringing clients into our clinic in September of that year. Jay had asked me to include some dollars and figures in this, and that so I went back and looked, and there was about between $250,000 and $275,000 to start up from Oasis to get us off the ground. And you know, with needing to meet regulations and have your program fully staffed at the time of bringing your clients into the clinic, you know, there's a big difference between generating no revenue and paying out full salary. So that startup was part of that. We did our renovations in-house with our own maintenance folks. So there wasn't a lot of cost, just materials there. And then there was some equipment costs with having to get a couple dosing machines, a new safe as part of that. And so other than that, you know, just the typical office supplies and computers and those kind of things. So most of the startup funds went towards staff salaries. And you know, in Jay's conversation, you know, that he said something that there may be some potential startup dollars for you folks. But that's our experience, was that really did help and really did cover our startup cost. Our experience with our ramp up was that we went very slow. We were relatively, other than in Syracuse, we were one of the few providers and the only providers between here and Plattsburgh. And so we chose in our budget to do a 10 person a month ramp up. And, you know, hindsight 2020, that is way too slow. And it cost us long term. So, you know, every client that comes in, the revenue associated with dosing goes up, but your costs stay the same for your staff until you hit a certain threshold of number of clients, and you have to add more medical staff. But if we could give any advice to any clinic that was getting ready to start up, we would, and we partnered well with a clinic in Oswego, and they were about a year behind us, and that's Farnham Family Services. They were about a year behind us, and their ramp up was half the time of ours to get to their 100 person, which is really the sweet spot in your staffing pattern, is about 100 clients. You know, Jay also asked for us to talk about our experience with and the need of our program. You know, we went, as we sit today, I know we're in the middle of a COVID crisis and things look different, but we have about 180 clients in our clinic today. And the need really hasn't changed. The need is still there. I can tell you that I've been in the field for over 25 years. And when I first started in the field, if you had an opiate diagnosis, it was not a real, it was pretty grim diagnosis that people had little success when you're an opiate addict. And I can tell you that today we've got 180 clients coming in our clinic that aren't a statistic. They come, they receive their medications, they participate clinically, and they get a chance to see medical providers on a daily, weekly, monthly basis. So, and then on the flip side, they're in group and they receive their individual sessions. They get their prescribing needs for psychotropic medications in our clinic as well. So it's kind of a one-stop shop for them. And I call it sitting behind the glass, but where we dose, I'll take time and sit back, and if you do it in like every couple months, you sit in there and you see the change of people who came in who were very physically distressed, emotionally distressed, and 30, 60, 90 days later, you have individuals that are they're different people than they were. They're healthier, they're happier, they've reunited with families. And I grew up in the era of AA and NA, and that's the only way. MATs in addiction services business to me was out there. And I can tell you that in the time that we've had our clinic, it's really changed my opinion of the need of those people, because I'm sure everybody reads the statistics, and the fact that you're looking to see there's a need in your county tells me that you see the statistics, and there'd be a heck of a lot more of those folks, of that 180, that wouldn't be with us anymore. So I can't stress that enough, that it definitely is a very positive thing for your community. Jay also mentioned that he would like me to speak to how we dealt with the stigma in our community. We really didn't have any difficulty in the community. At the time, Jim Squirtle was the executive director, and he did a lot of outreach with all the different entities in the community, probation, the judges, the sheriff, really spent time educating those folks about MATs and the need. And the community had been experiencing such a high death rate in overdoses that the community was really looking for some type of alternative to where we were at the time. So, I really Karen is our clinical guru, and if she'd like to add to that, I'm sure she's got another piece for you, but let her kind of talk through that, and then we're open to any questions you may have.
Okay.
So I would just add, just briefly, and then I can answer any questions you have, that the OTP really offers the opportunity in the community to provide an additional service to clients. The MAT service is really important for a lot of clients, and in the OTP, they also have the benefit of potentially having services from peers, as well as care management and those added medical and clinical services. Because of the OTP with the daily dosing, which when we say daily, it's 6 days a week for people who are first admitted, that gives a lot more perspective and opportunity to see a patient and to meet their needs a little bit quicker, and also see how many problems or challenges or areas that they really need some assistance with. It's helped us to be able to keep people in treatment, to obviously keep them safe, and help them on their journey to recovery, whatever that is. Some folks are still with us from the time we opened our clinic in 2016 and 2017, definitely. And we're happy to have them receive that service for as long as they believe that it's necessary and is working for them. We also have people that have transitioned from methadone to Suboxone. We've also had patients that have transitioned out of our OTP into our outpatient clinic because that's the best type of care that they've decided is for them as well. And so the OTP has really expanded our ability to care for the person that is quite vulnerable to overdose risk and potentially having other consequences in their life, like legal issues, child protective issues, serious medical harm, that sort of thing. So we also have a lot of people, what John was alluding to is nice to see that people are getting well. They're getting back into the workforce. They're getting back into their children's lives. All of that you can kind of see on a daily basis, on a weekly basis in the OTP. And it's been a pretty rewarding experience, and it's been challenging along the way. We've figured it out as we're going, and we had the benefit of some SOAR dollars that have come in as well to help support and with outreach, so that even helped us bring even more clients into our OTP services. So I'm happy to answer any specific questions that the group might have.
Okay, thank you. Who would like to ask? We have John Burke, Mr. Burke.
Hi, what's the overall efficacy of the methadone treatment, and how long does it take on average for a person to be able to wean off the methadone?
I would have to bring our medical director on to talk about some specific dates about coming off of methadone. The preferred treatment methodology for opioid use disorder, especially moderate or severe, is medication-assisted treatment along with therapeutic therapies, generally CBT type therapy. So the folks in our clinic in the OTP, they would be taking the medication for as long as they believe it's necessary and their medical provider believes it is an effective treatment modality for them. So some people will decide that that's months or years. Other people will decide that they don't really put a time limit on it. It's working for them. They're able to engage in life and be well in the way that they're satisfied with, so they can remain on the medication for as long as they choose to. People can be in their 60s and 70s or whatever and still be taking methadone if that is the preferred treatment method of that they have, as well as their medical provider.
Okay, thank you. John, do you have a follow-up or?
Yeah, I do.
Yeah.
Have you measured the effectiveness for the people you serve? I guess I'm wondering, it certainly sounds like the desired outcome is to be free of illicit drug use. So if that's the case, what does your data show as far as the overall effectiveness of methadone over time? A lot of recidivism.
So the data from CRADO is not necessarily going to collect information exclusively on reduction of illicit drug use. There's absolutely evidence that over time, people do reduce their illicit use during their time that they use methadone or Suboxone, any MAT. But there is also a period of time where they might continue to use illicitly. And that is part of the treatment that you provide to that person, and you continue to provide it for as long as is deemed medically necessary that they can receive that MAT. So I definitely can't give you a number on that, and we do not. We are certainly monitoring and testing people for other use of drugs, but part of an opioid use disorder, especially a moderate or severe disorder that you would have to have in order to be eligible for an OTP, is that there is very frequently going to be other drug use and potentially pretty frequent or serious drug use. So you do expect to see that for quite a period of time while someone's in an OTP. It's definite. An OTP is not the same level of care as an outpatient substance use clinic.
Thank you.
Mr. Wilson, would you like to add something?
Yes, please. John, we have our OASIS has a medical director, and he compares MAT use similar, if you were to take diabetes, for example, it's a medical condition that has certain prescriptions associated with it in order to maintain a person's health. And at no time during a doctor's treatment of a patient should he consider if a person's, not being, not following a particular diet and he's still having difficulty with his sugar, or if he's consuming alcohol and it bothers his sugar, that he really does a nice job of explaining that there are ebbs and flows to it. But the idea is that a person who is on an MAT is much safer and much less likely to overdose and die, and they're also much less likely to commit crimes associated with their addiction. And when we were first in the OTP business, we had a person who was transforming in from California, and OTPs have been pretty popular on the West Coast for a while. And this woman had been using MATs to fight her opioid addiction for over 20 years. And I found that and I remember that very vividly. And then I found that was very telling, because this woman was transferring here with her husband in the military, and she was employed in our community. And many would say that the idea would be to wellness in the old school would be that a person would transition out of such a situation. And in fact, there is no real end time unless the person determines that there is an end time, if that makes sense.
That's great.
Okay, anyone else? Mr. Lightfoot.
Thank you. John, my name's Joe Lightfoot. I'm interested in a couple of things. As far as the area that you serve, can you tell me from where to where it is? I mean, I'm told from all the way from Onondaga to Clinton counties. Is that accurate?
Well, that I think that there's some. I don't think that's really accurate. Our catchment is primarily Jefferson County, but there is we have I think 16 that come from Lewis County and another dozen that come from southern St. Lawrence County. So we know that there's a need in your county because those folks are not coming and traveling to our clinic so much. And Oswego County has its own services, and so does Onondaga and Oneida and so on. So again, that catchment majority of it is Jefferson County.
How many, if I may?
You may. Yep.
How many actual clinical locations are there? And if you have more than one, how are they staffed? How do you man those clinics?
Well, we have just the one OTP clinic that we dose out of in Watertown, and any additional clinic would have to be staffed the same way as far as medical staff goes, because you have to have an RN in the system. You can have LPNs that can dose, but they have to have direct access to an RN during dosing. And your medical director, we chose to go full time with our medical director, but that could be parted out if you had other clinic because they can have a certain number of hours per number of clients in your clinic.
Okay, so you need somebody that is the head of the clinic. You need a registered nurse and perhaps LPNs also. What are we talking about in numbers of those people to run and manage that clinic on a daily basis? What are you looking at for staff, and what's it comprised of as far as their job descriptions?
Yeah, I think Karen can run with this, but I will say that when we went into Lewis County, we went in and there was a county-run clinic in Lewis County, and in comparison to what our expectations of caseload, that's going to determine the number of clinicians you need to take care of those folks. If people are running a caseload of active clients in the 20s, you're going to need more clinicians. But if you're able to have a stratified caseload, you can have a clinician have a relatively high caseload as your clinic matures. So we're around the 45 clients per clinician, I would say, and Karen can Karen can clean that up for me, but I think that that's pretty close. And then you have to have 2 people during dosing, 2 medical staff, well, 2 people during dosing, one of them a medical staff, because you can't, DEA has certain expectations and regulations that you have to follow for your medication, both storing and counting and witnesses and all that kind of stuff. So Karen, you go ahead and take it from there.
Yeah, I mean, just to expand on that, you have to have a medical doctor who is doing your assessment of your patients to admit them into the clinic. You can apply for a waiver for a mid-level provider, but at first you're going to need a medical doctor to do that. They have to have a physical exam and they have to be, especially for methadone. You need your nurse supervisor. You're going to need at least 2 additional LPNs or something like an LPN, because you need to staff 6 days a week as well. You have to have those shifts. You have to have a clinical director or some sort of clinical supervisor that's in charge of the work that's being done. And then you would certainly need to have, just to open, you would need to have an additional clinician. And then, like John is saying, up to about 50 or so patients, you need to have additional clinicians. We do quite a bit of group therapy. Not every OTP still does as much group therapy. So we do have additional clinicians so that we can accommodate group therapy. OASIS also, more than likely, I believe this is true, requires programs to have a peer advocate as well that works in the program. And then after that, certainly you would need to have some level of administrative staff to help with documentation, check-in, things that have to be done administratively. So there are some minimums that are in the regulation from OASIS that you have to meet even up until you get to certain thresholds of clientele. And that's written pretty strictly in the regulation between SAMHSA and OASIS.
How many people do you have on staff at your Watertown clinic now? Total.
So that just serve the OT. So we're an integrated clinic, so we're a little harder to answer that question. But that are serving the OTP without doing much work for the other clinics. I would say that we're right around 15.
Okay, thank you. Mr. Chairman, I have 2 more questions if you'll permit me.
Sure, go ahead, Mr. Lightfoot.
The second one is security. You must have some security needs or requirements that go along with what you're providing and the people that you're providing it to. Can you tell me what your security needs are and how you fill them?
So OASIS does require, as well as SAMHSA, that you have, you take into account the security needs of your clinic and how it impacts the community. So there's as John was mentioning, there's a lot of rules around the secure nature of the medication because you're a dispensing medication. And then in order to run the program, you also have to take into account, you're required to ensure clients are as far as waiting for services outside of your building, that you are maintaining the property. They sometimes they refer to it as just your community, that your kindness to the community, that clients aren't congregating on your property, things like that. So different programs do it different ways. We do employ peers to help with this process, as well as administrative staff to help with this process. And we have chosen to also have security personnel that we contract with on our property during our dosing hours. Some programs do that the same way we are, but you're not required to, but you have to address the need that you're going to have potentially a lot of people coming within short periods of time to your clinic, and that there's not congregating outside your building.
Okay. My last question has to do with the DEA. There's a permitting process that one must go through to get the DEA's blessing on the drugs that you are prescribing and administering. How long a process was it with DEA, with you folks, when you went through that process?
I don't know the
I
time
will-
exactly, but I do know that that process kind of flows as Oasis gets involved and approves your ability to have a program open. But you do have to take into account that you're going to have that communication with the DEA, and there's lots of governing bodies. So I don't know, John, if you remember a time frame, but I'm thinking within a few, you have to have your license in place and your approval through Oasis, and that kind of all you have an Oasis liaison that kind of helps you move through those processes.
Yeah, I want to say it was around the 6 months, I think, is the total process took. They have to come on site and approve your site plan, and then they come back and inspect your site plan and go through that process with you. And everything has to be cameraed and safed and
Well, and I hope that somebody else asks that question. I don't want to dominate the conversation here, but that was one of the other things that I was interested in is the building, the security that you need for it, the upgrade that you might need, whether you rent, whether you lease, whether it is a county building or somebody donated it. I don't want to get into that personally, but I hope somebody else will. Thank you very, very much. It's very informative.
Well, if you'd like to answer that question, because actually, let's move on, Mr. Reagan. Well, you want to answer that, Mr. Wilson? Would you like to answer those questions that Mr. Lightfoot just asked, or Karen?
Sure.
Okay.
Sure. We used our existing outpatient clinic and modified our administrative space. Really just, we used our in-house staff. I come from a trades background, so we went through, moved administration off site, and then just modified the existing space. And our building is owned by us, other than we have a lien through Oasis on it for a capital that we did back in, I don't know, say 2008. There's still a lien on that property.
Okay. Thank you,
Thank
John. Next up, we have Legislator Reagan would like to ask a question. Jim?
Mr. Wilson, is Credo interested in running a program in St. Lawrence County?
Geographically, it would be a difficult reach for us. We are never turn anything down for a conversation, I guess, at this point, but your county is very large, and to figure out where that would be centrally to meet the needs of Messina and Ogdensburg and Potsdam. And, I know where if I throw a dart at St. Lawrence County for that conversation, it comes to Potsdam, Canton. But, the middle of COVID right now, if that's a pushing need, there's a lot of variables right now that make that conversation feel kind of difficult.
We've been approached by St. Joseph's. They've expressed an interest in operating a clinic, and I was hoping that they would be doing a presentation tonight so you could hear about them, since they have a lot of experience with inpatient programs as well as outpatient programs. And I was just curious, Credo has a great reputation and has done a wonderful job in Jefferson County. And we do appreciate you offering your advice, and we, may lean on you in the future for more. So thank you for taking the time to talk to us.
So
Absolutely.
So Legislator Reagan, I'm responsible for the change because actually after our last meeting, Jay had reached out to St. Joe's. But then I thought actually from your comments the last Monday that they actually were involved in actually doing a clinic. So when I found out they were not, I thought that the questions that the legislators would ask would be probably, right on a day-to-day. And so Credo is actually functioning and operating a clinic. I thought they would be able to answer our questions better than having St. Joe as well. Maybe we could do this, maybe we could do that. And so I think Mr. Wilson and Ms. White here can answer our questions specifically. It's not a hypothetical. So I'm responsible for the change. It's not that if we did, I think Jay, you could chime in. I think Community Health Board would have to do an RFP anyway if we decide it to entertain an outfit. Would that be correct, Jay?
Yeah, that would be our preference, yes. So that there's, there's no picking one organization over another. We would do it that way, yes.
So at
Does-
Credo, we're happy to help give a presentation like this or help with technical assistance along the way. No matter what the relationship is, we're a partner and are happy to help in whatever way we can. We want to see everyone else just as successful as we are. It helps our communities no matter where we're located.
So we have the two questions is there a need for a clinic here in St. Lawrence County? And then the second question is, would the county take on that responsibility or would they have a private entity? So one of the things that we're concerned about with the clinics, of course, is the county cost. My understanding, Mr. Wilson, is that part of Credo is actually running in the black financially.
That for the, well, we were until about 5 or 6 weeks ago.
Sure.
There's been quite a change in how we provide services today, but there is, with the ability to bill for the dosing, every time a person comes into the clinic, there is enough dollars to come in to support your staffing once you hit a certain threshold of clients.
Right.
And that threshold is 100 individuals approximately.
I would say at least, yeah.
Yeah.
So Jay, we have approximately 250 people that are receiving treatment now with Suboxone or other medical MATs.
Within the county, it's closer to about 500 individuals that are receiving opioid treatment, MAT services.
Okay.
For the county clinic, 78%, we're serving 84. So about 78% of those are getting prescriptions either 2 or 3 days out because of their inability to self-regulate, say a 30-day dose. And I don't know, if Karen or John has a comment on that in terms of what that indication is, what that indication means to you. But we're being told that indicates a higher level of care that is needed.
Yeah, what you'll find is that a lot of times that client you're describing would benefit from a higher level of care, but inpatient is probably not the answer because that takes them out of the community and it's not really solving the issue that perhaps an OTP could solve, that you come and safely get your medication dispensed to you 6 days a week, and then you eventually get additional take homes. So that with having an integrated clinic like we do, we serve clients with a prescription for MAT as well, but clients that cannot do that independently, or it's not therapeutic for them to do so, or they ask, can I come to the OTP? It's been a real help to have that optional service, which is considered a higher level of care than traditional outpatient, and certainly higher level than getting your MAT from a primary care doctor.
Okay. Does anyone else have any questions? Yes. John, Mr. Burke? Go ahead, John. You're still muted, I think.
Okay, sorry about that.
You're good.
I wanted to know, your medical director is a physician, is that correct?
Yes.
Yes.
And is he full-time, he or she full-time? And what specialty do you look for, or is there a specialty at all?
Dr. Paisanello came to us from Lewis County. He had already he was interested in prescribing addiction medicine. He had his X waiver at the time that we began our relationship. And he, kind of had a passion to want to work with the addiction side of things. He came from a primary care setting in Lewis County and did some work in the hospital there as well. you know, he's full-time with Credo, but he serves 2 roles with us. One, he's the medical director of our OTP clinic, but he's also the medical director of our iOS clinic, which is Integrated Outpatient Services. So he oversees all our medical staff and all those clinics, all our policies and procedures, treatment planning, and so on. So, you know, there's a, and I have to get the number for you. I don't know. It's so many clients per number of hours he needs in the clinic. And Karen may know that off the top of her head, but
I don't.
you would have to do the math. So for 100, I think you would need 4 hours, I would think, but I don't know, Karen.
There are a lot of I don't know it off the top of my head, John, but there are a lot of clinics that are on the smaller side. And our OTP clinic is still considered small, that do not employ a full-time doctor in their clinic for that reason. But our doctor fulfills those many roles, so he is full-time with us.
It does have to be a doctor that can come on site though, because as Karen said a little bit ago, they have to be able to do face-to-face physical assessments. So you can't work exclusively through telemedicine with that type of medical director. It would have to be someone that could physically come in your clinic.
Thank you, John and Karen.
Okay, Mr. Lightfoot.
One last question, if I may. Is there any collaborative effort or any coordination between Credo and other service providers? You know, not necessarily medical people, but there are so many other services that these people probably need. Is there any outreach to them? And do you interact with them and collaborate with them to provide additional services?
We do, within Credo, we actually have care management. We have care managers through the CNY Health Home. We also coordinate and collaborate with a lot of other community members. As part of a clinic, I don't know if you're required, but you're definitely encouraged to have some of those collaborative agreements with some other primary care doctors in your community to make sure people are getting regular health care, as well as the other OASIS and OMH facilities in our community. We do a lot of collaboration and assistance across systems with people, recognizing that our clientele often have multiple issues. We also certainly have a lot of collaborative opportunity and relationship with legal entities and Department of Social Services, that sort of thing. But when you provide care at this level, you certainly are, the more skilled your staff are at helping the client with what can at times be a lot of challenges that they have in their life, the more you can do that, the better, the more successful they will be in treatment as well as in their life and hitting their goals.
When you were putting this together, your staff, did you find that the staff within the immediate area that you encompass now had the expertise that you needed, or did you have to go elsewhere and cast a wider net?
Thankfully, it was a little bit of both for us. I'm happy to say that opening the clinic in an integrated, already within another clinic, was very helpful because we had expertise amongst our staff that so that we could provide treatment for people with a serious opioid use disorder. So that was really helpful. But you will find yourself, no matter what, really hunting for people, whether they're in your community or they want to come to your community that have expertise to work with a population that has challenges that are unique and sometimes more severe or just different than a traditional substance use clinic. You certainly have to be ready to recognize trauma-related symptoms because that is a pretty frequent concern of clients that are coming into care. And so we had to do a little bit of both of those things as far as to get the staffing. You want to, OASIS really wants everyone who's working with clients in the OTP to have a CASAC, and if possible, to even have a license. But they're very, obviously they're very concerned that these that we're working with a population of client that needs our staff that are seasoned in what they're doing.
Lastly, what's your staffing turnover rate?
Our staffing turnover rate, we usually this is our integrated clinics. We usually are right around the 2.5 to 3 year mark for clinicians. That's our average. Obviously, with an average, some are longer, some are shorter. We are a program that definitely hires staff that are connected to the military. So we actually see attrition that way, not always because the person doesn't want to work with the clientele anymore. But I do think to have a healthy workforce, you have to recognize that this is challenging work, and you want to help people maintain this work for several years, and you have to help them put the pieces in place that keep them well, the staff well, and that they can continue to care for the needs of the clients. So John, I don't know if you would think our rate is any different than that for turnover. At the clinician rate, manager rate, I mean, I've been around 14 years, so that's, in our organization, that's a little different.
Yeah, I think that the clinic is much more stable now as far as turnover goes, and it aligns itself with our other systems. But initially, the first year was difficult. There was a lot of stress associated with that, and I think that all of us were stressed with the opening of a new clinic, and we had about a 75% turnover in that first year, but we don't now. But again, we didn't have many people that we could help get us off the ground, so we were really alone in it. And I think that if St. Lawrence County was to open a clinic, and there's a lot more advice out there now on how to have your startup of your clinics, and people willing to work and have an understanding of what needs to happen to open an OTP clinic, that you wouldn't have that same experience that we did.
Yeah, we learned a lot in that first year for sure, and thankfully we were able to lean on staff within our whole system that could also come to the aid of those that it wasn't a good fit for in that first year. And when we had talked to other programs, and we had been prepared for that this is just a new service. So not everyone that starts the service is necessarily going to stay forever. But I'm happy to say there is a core group of people that are still with our OTP. They feel passionate about it, and they're still with us, and they think that they help spread that passion to the new staff that have come in.
Well, thank you. I could ask you a lot more, but I think you've given us a lot to get started with, and I thank you very much. Very informative.
Well, I do encourage that if you have more questions or things that you would like answers to, I mean, Jay knows how to get a hold of me and Karen, and so feel free.
Absolutely. Happy to help answer anything.
Ruth, do you have any questions that you'd like to ask yourself?
Not at this time.
Okay. Does anyone else? I don't see any hands up. Well, I'd like to thank Mr. Wilson and Ms. White for very informative and taking time out of your evening to speak to us. You've given us a lot to consider, so thank you very much.
Thank
Okay.
you. Thanks for having
Thank
me.
you.
Thanks for having us.
Thank you.
Okay, so we'll move on with the rest of our meeting. It's the Workforce Opportunity Innovation Act. We have Barb Lashwa. The first resolution is modifying the 2020 budget for Workforce Innovation and Opportunity Act for the fiscal year 19 WIA budget to transfer formula funds from dislocated worker accounts to adult accounts. Moved by Mr. Forsyth, second by Mr. Perkins. Ms. Lashwa.
Hello, everybody. I hope you're well and everybody's feeling up to par with this crazy world we're living in. So basically what we're requesting to do is to move some funds that'll provide a little more flexibility for us as we move forward. And we don't believe that this will impact our ability to offer services to anyone who's eligible. These funds are pretty easily transferable, unlike the youth funding that we're provided. So that's our request. Anyone have any questions?
No questions. Seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed? Motion carried.
Thank you.
All right, thank you, Barb.
Thank you, Barb.
Take care, everyone. Anyone have any questions about workforce development before we move forward?
Barb,
All
right.
if you,
Go ahead.
Barb.
Mhm.
We talked a little bit in pre-committee just about sharing with the board a little bit about how you've modified the work for folks during this time. We certainly understand a lot of folks are on unemployment or trying to. How are we meeting those needs?
Okay, I actually brainstormed a little bit with the staff, and moving forward, I broke it into pieces here. Basically, summer youth is coming up, and that is pretty a pretty good chunk of our program. To this point, we have not heard that summer youth will not be allowed to happen through WIOA. However, we may have to look at a little bit more creative way of delivering the services. So we've been creating flyers for the local high schools, advertising our programs. We're going to ask the high schools to put the flyers in the bag lunch programs that are being passed out. We're also sending things via email to the guidance counselors for them to forward to students that they think might meet the criteria for our summer youth program. For the first time, we have a fillable application on our website so that youth can apply for work without having person-to-person contact. We're exploring some virtual delivery programs for youth. We are also contacting past participants directly to see if they may be able to be part of the program again this year. And we are setting up online interviews for summer youth, thinking that a lot of what the kids do will be training, soft skills, those things via the internet. So that takes care of youth. In general, our staff has been contacting work sites to secure agreements, ask for input from the work sites for possible ideas for virtual connections. We are contacting present and past participants to check in on them, offer guidance. We do have one person in the office every day during regular hours. They're making referrals. They're helping people with food banks, partner agencies. They're offering guidance, reassurance, phone numbers for applying for unemployment insurance. We are contacting participants where it's appropriate because we are keeping up with the local job listings. So when there are openings and we know there's somebody that's a good fit, we make that contact. We are also encouraging people to participate in online training. We have an incentive policy, so we're trying to fill a void there. And we are also remaining in contact with Department of Labor. We're trying to keep improvements on our media, all those types of things. So we've been busy. It's been a challenging process, but the one-stop staff really deserves some kudos. They are a phenomenal group of people, certainly with the best interest of St. Lawrence County residents in mind. So I'm very grateful for that.
And Barb, I just want to thank you also. I'm going to share with the board later about some of our alternative plans. And one of those includes using the space in the One Stop to get some of the contact tracing done for public health. So thank you and the partners for being agreeable to help out.
Absolutely. Absolutely. They were more than glad to help.
Thank you.
Thank you, Barb.
Okay, everyone, take care now.
You bet. Thank you. Next up is our Sheriff, Brooks Bigworth. We have a couple resolutions. The first resolution is proclaiming the week of May 3rd to the 9th of 2020 Correctional Officers and Correctional Employees Week in St. Lawrence County. Moved by Ms. Rita Curran and second by John Burke and Mr. Lightfoot and Mr. Reagan. Okay. Any discussion? Brooks, would you like to speak to this resolution?
I would. This isn't recognition of our county corrections officers. This is also our state COs, not only in our county, but throughout the state. Obviously, with this COVID-19 going on, they've had to really step up and really do some more things in the facility that they've never done before. There's no book on this, so what we're doing in our facility and what the state facilities are doing is a lot of new things, new policy, new procedures. In our facility, I can tell you that our corrections officers have adjusted their schedules to assist us, and they've really handled the policies and procedures we've instilled to make the inmates and themselves and the facility as safe as possible. So they've done a lot of things there. Just a side note, obviously it's a more stressful environment for them, and they're really stepping up to the plate. And last week we had a CO that was kind enough to make some masks on our own time. And again, I talked about this last week about getting our inmate staff to do that. And that's probably going to happen in the next few days. So that's something they're doing in the facility. So not just for the county COs, but this is also for our state COs out there. And I think it's a great recognition, and they should be recognized.
Thank you very much, Brooks. Any comments from the legislative body this time? Seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Our next resolution is proclaiming May 15th of 2020 as Police Officer Memorial Day during the National Police Week in St. Lawrence County. Moved by Mr. Curran and second by Mr. Denisha, Mr. Terminelli, Mr. Lightfoot, and Mr. Reagan. Did I miss anyone? Okay. So Brooks, could you speak to this, please?
Sure. So it's kind of same scenario as with the COs, but it's one day that's been going on since actually John F. Kennedy started this in 1962, where we recognize our law enforcement personnel. This also would be our office, the sheriff's office, the town and the village PDs, New York State Police, and all of our federal law enforcement partners, HSI, ICE, Border Patrol. We're all working on this COVID crisis together more than ever. And they're assisting us with the pause, executive orders, and all the COVID things that we're doing out there. And all the officers are still out there handling complaints. They're dealing with accidents, helping out with the travel advisories. And they just adjusted very, very well. So I think this is apropos this year more than probably most years that we recognize our police officers. And I proclaim that the 15th has a relation to him.
Thank you, Brooks. Would any legislator like to comment? Mr. Lightfoot.
I'd like to be added as a co-sponsor. And I've got to say that I think for a great number of us, we take our law enforcement for granted. They're out there, all they're doing is writing tickets, stopping and harassing us and, making our lives miserable. Boy, you don't see the other half of what goes on and how it is handled, how it is how it affects law enforcement and the individuals that chose to serve in that area. They do an outstanding job. You hear about the bad things. You seldom hear about the good things, but they far outweigh the occasional bad thing that makes it into the newspaper. So I got to say, this is very important. It's dear to my heart, and I'm very much in favor of it. And I think it's the very least we can do to recognize these people, particularly in light of the numbers that have given their lives over the past few years. It's unbelievable the sacrifices that they make and have made. So thank you.
Thank you, Mr. Lightfoot. Anyone else? I think Mr. Lightfoot captured it. Law enforcement's like going to a restaurant. If you have a bad experience or a bad meal, you're going to tell 10 people. But if you have law enforcement, you have a good meal, you're going to tell a couple. So we appreciate the work that you do, Brooks, and the men and women that you have working for us in St. Lawrence County.
Thank you.
So seeing no more discussion, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Thank you, Sheriff.
Thank you.
Our next resolution is a resolution from Ms. Arquette. Nancy, would you like to read your resolution, please?
I'd like to present a resolution proclaiming May as National Foster Care Month.
Is there a second? Second by Mr. Burke and Mr. Fay and Mr. Rita Curran and Mr. Reagan. Okay, discussion. Nancy, would you like to talk about this?
I would. National Foster Care Month was established 30 years ago and to raise awareness for the challenges that we have with the foster care system and bringing foster parents or support families into the system. So the increasing number of children in foster care is an unfortunate reality in St. Lawrence County. And we currently have over 300 children in the foster care system. So during National Foster Care Month, we would like to commend those who have stepped up to assist by becoming foster parents and caregivers, giving selflessly of their love, time, and support to these children. It's important that we continue to support and assist the children who are in the foster care system. And I'd like to bring forward that there's a need for foster parents interested in fostering sibling groups, teenagers, and children with special needs. So if there's anyone that you know or someone that would like to learn more about being a foster care parent and learn more about the process that goes into that, Fostering Future is going to be holding their next informational meeting in June. And I can give information on that if you'd like also as to who to contact.
Certainly.
Okay, so to become part of the Fostering Future classes, you would get in touch with Melissa Hale, who is the foster care program manager there. The contact information for Ms. Hale is 315-229-3503.
And the last name is Hale, H-A-L-E?
Yep, H-A-L-E, Hale.
Okay. Thank you very much. Any other discussion on this resolution? Seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. The next resolution is from Highway, and it's modifying the 2020 budget for the Department of Highways for CHIPS revenue rolled over from 2019 to be used for paving projects. Moved by Mr. Burke, and second by Mr. Nisha, and Ms. Curran, Ms. Arquette. Anyone else? Did I miss? It's hard to see everybody, but okay. Mr. Chambers, are you there for us?
Yes, I am. Thank you. Yes, in 2019, we had funds, CHIPS funds available to roll over to 2020 for expenditures for paving projects. And with the increases that we've seen right now with the bids for materials, it certainly will go a long way to helping us maintain services.
Okay. Any questions for Mr. Chambers concerning this resolution? Larry, have you got your hand up?
No, thank you, Mr. Chairman. I wasn't going to, but I had a conversation with Mr. Chambers last week, and I knew it was in regards to the relationship between the price of fossil fuels and blacktop. And I asked him if he might consider speaking to the board about that.
Okay, certainly. Mr. Chambers, would you like to comment?
Yes, thank you. And thank you, Larry, for asking that. Yes, part of the issue that probably a lot of people don't really think about is that there's really kind of a disconnect between the prices of a barrel of oil and the price for a ton of asphalt oil, because the oil, the bitumen, the asphalt oil, is the remainder from the refining process. And so right now with the decrease, and even though there's a extremely low oil prices, there's also a extremely low output of the refineries, which then in turn reduces the supply of asphalt dramatically. And with the project planned across the state and the nation, it could potentially make a shortage of bitumen. So there's likely to be quite a disconnect this season between what you see as oil prices and the actual bitumen, the asphalt oil in the market. So I have spoke additionally with some people that are in the supply side of the oil. And they're saying that it should stay. They're hoping that it's going to stay relatively flat because the storage is relatively full. There's a lot in reserves right now, which will help stabilize it. But I just didn't want the board to expect to see a huge drop in bitumen prices because of the low production, low cost of oil. But the other side is the low production of bitumen. So hope that explains it.
Okay, thank you, Mr. Chambers. I would ask, is that going to carry over to fuel prices, or fuel prices should be down, should they not?
Yes, the fuel prices are down. They're down substantially. And there again, there's the disconnect. The price for bitumen is down just marginally, whereas the cost for fuel is down substantially. So there's that disconnect. So I just wanted to draw that to the board's attention.
Okay. Any more questions concerning this resolution for Mr. Chambers? Seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Before we go on to the next resolution, if you got your hand up, I'm looking at all of us, so keep flashing your hand so I can see it, because if you just stick it up once, I don't know if Mr. Denisha was asking a question or not, your hand went off the screen on my end. So just be persistent, just keep waving, and I'll get you. We want to get you, but make sure you have credit for what you want to do. So our next resolution is approving federal aid highway project for the engineering design and right away from County Route 35, which is Slab City Bridge over Trout Brook. Bin number 3341-700, pin number 775 394, and modifying the 2020 budget for the Department of Highways. Moved by Ms. Curran, Mr. Lightfoot as a second, along with Mr. Perkins, I believe. Mr. Chambers.
Yes, the county was lucky enough to obtain another project through the federal aid program with the New York State DOT. This project is located on County Road 35 at the intersection of the Potsdam Morley Road. And this structure, I think about a month and a half ago or so, I did send the board an email with some pictures of the underside of the structure. The structure will likely require some reworking of the intersection and maybe some realignment of the stream in that area.
Okay. Any questions for Mr. Chambers? So I had to pick up some essential items at Tractor Supply today, Don. Are you thinking about doing I see how that stream comes in at a 90-degree angle, then crosses. Are you going to go diagonally across there to change the stream?
That may be, that's exactly what I was getting at, and that which may require us to also look at some intersection changes. But yes, we would be looking at trying to make it more hydraulically efficient, because right now basically the stream comes down and does 90 degrees, which makes scour. It basically excavates the bottom of the stream bed, which is not desirable. So it adds to erosion. So likely to have a slight realignment of the stream.
Okay. Any other questions for Mr. Chambers concerning this resolution? Seeing none, all those in favor of the resolution signify by saying aye.
Aye. Aye.
Opposed, motion carried. Thank you.
Thank you.
Don,
Yes.
Mr. Chairman, if it's possible to have Don speak briefly to how Highway's modifying their operations as they've returned from the facilities being closed, and what folks might expect to see on the side of the road as projects are getting done, and what to expect out in the public.
Certainly. Mr. Chambers.
Yes. We are right now working on the field staff 50%. We are going from basically to try to have some isolation between the work groups. We've split each work group into smaller groups to increase the social distancing, as well as having one group work 1 week and then take the next off and have the corresponding other half of the crew come in the next week. But we are having our supervisors come in, for both weeks, but keeping keeping social distancing and wearing PPE to provide some protection.
Okay, any questions for Mr. Chambers concerning day-to-day procedures? So
Thanks, Don.
So Don,
Thank you.
I do. So you think production wise, where are we going to be? I mean, we obviously, with these type of procedures, we can't be at 100% of our normal production level, or of course that would be the goal. What do you think that we'll be able to, how much of this work are we going to be able to get done?
Well, what I'm going to try to do is accomplish the road work and the bridge work that we've got planned as much as possible. Some of the other items that we may have to curtail on, but the capital projects are that's where our revenue comes from, and also the majority of the public enjoys the benefits of the newly paved road or the replaced culvert or the repaired bridge. So I think some of the other maintenance items may not get as much attention as I would like to see them get, but it's a kind of like a triage situation where I think it's wise to keep the road projects and the bridge projects that we desperately need to get done, keep those on track as much as possible.
Great. We appreciate your efforts.
Thank you.
So next up is our county administrator's report with Ruth Doyle. The first resolution is modifying the 2020 budget to share occupancy tax with the St. Lawrence County Chamber of Commerce as prescribed in the 2018 and 2020 agreement for tourism promotion. Moved by Ms. Curran, second by Mr. Burke, and Legislator Arquette. Ms. Arquette, I believe you had your hand up. Ruth?
Thank you. So this resolution comes before you to modify the budget. This is the last year of the Chamber of Commerce agreement that we have in place for tourism promotion. They will be joining us next month to talk with you about what's happening, how they're modifying things in light of the business situation we're in at the moment. But that being said, for 2019, there'll be an increase of the 75%, which comes out to the $42,093. So over the 3 years, in 2018, it was $36,000. In 2019, it was $35,000. And 2020 is the amount before you this evening. We budgeted in 2019 $450,000, which, as many of you who followed this over the year knows, that's an additional increase over the year before. We actually came in at $505,301.29. So in keeping with the arrangement, we share that amount. We certainly expect this year to see a decrease in what we receive. We'll be working on that, but this resolution would fulfill the obligation of the contract.
Okay.
Any questions?
No, I don't see any, Ruth.
Okay.
So all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Our next resolution is establishing a standard workday for the New York State Retirement System reporting purposes. Moved by Ms. Curran, second by, we do not have a Mr. Perkins. Okay. Ruth, go ahead. And
So
Mr.
this
Arquette,
resolution
okay. I'm sorry.
is the standard reporting requirement. And with our two newly elected officials, they were prompt in completing their logs of work, and we were able to prepare this for you to consider this evening, which will be followed up by posting as required by New York State Retirement for 30 days.
Okay, any discussion? Kelly, would you please note that Mr. Arquette wanted also to second that this resolution? Okay. So all those in favor of the resolution signify by saying aye.
Aye.
Opposed? Carried. So next up is 2020 first quarter financial update. Ruth?
So you have in your Google Drive the summary report as well as the category report provided. It's certainly no secret that we're going to have to look very carefully at our second quarter and beyond, but our first quarter didn't turn out too bad. So within the comparison for 2020 to 2019, which is typically how we do things, in our 100s or our salary lines, we came in 0.5% below where we were this time last year. However, we budgeted $76,000 less. In our 200s or our equipment accounts, we're down 9% over 2019. In our 400s, which are our contractuals, we're down almost 1% or 0.8%. We did budget though, if you'll recall, this is a big year for highway. And so those appropriations, if you look at overall, which is on that first page of your category report, there's an additional 14.4 million budgeted. So in that way, we are at the first quarter, 1.6 million over where we were last year. But overall, it's a decrease over 2019. And in our fringe or our 800 accounts, I'm sure you noted we were up 4% or 1.5 million. However, keep in mind that with the changes that we've made and looking at our budgets closely, we've budgeted $2.8 million less this year over 2019. And in our revenue, the 500s that you'll also note there, we are down 2.3%. However, we budgeted 13.2 million more, again, as a result of the highway appropriations and revenue for this year. So overall, it's a $2.8 million increase in revenue over where we were in 2019. The summary report, as I indicated in my email to you, can be a little difficult because in the 5 departments that I shared with you, those being Board of Elections, County Administrator, County Clerk, Real Property, and the Treasurer, they come in as negatives because revenue is received early in the year and appropriations don't catch up until well into mid or late 2020. There are 9 departments at this point that are above, just above in some cases, that 25% mark or the quarter of the year. And so I think when we looked at those closer and drilled down into those numbers, those result from a lag in revenue. So most of the revenue associated with the work that was done or revenue that's expected for the first quarter was submitted in April. And this is something that we run into on a quarterly basis, but I want at least to draw that to your attention for the first quarter of 2020. I think it's going to be imperative going forward. As you would imagine, I'm already looking at a number of challenges or changes that we may need to be looking at for the second and third quarters, and certainly for the budget for 2021. But I think that the first quarter, the big numbers that are typically interest is shown in, give me a moment, is in the health insurance and in overtime. Just trying to put that report out right now. What did I do with it? We are slightly down in our appropriations budgeted for overtime. However, for the year, we're at 31.6%. So keep in mind, we set aside an amount in contingency for the budgets associated with overtime. And certainly in some unsuspecting departments this year, like public health, we're seeing quite a bit more overtime, as well as in social services. So we'll bring those budget modifications to you probably earlier than we have in other years. Another number that the board takes great interest in is health insurance. And that is just under 25% for this year at 23.3. Right now for a $13.5 million health, and remember, we've broken out the health by pharmacy, by health, by administration. We're at about 3.28 million spend. And in pharmacy of 6.6 million budgeted, we're at 1.43 spent. So we're tracking okay at this point. I think certainly we're going to watch these areas very closely. Along with sales tax and with property tax. I remind you with sales tax, we will be making payments here very shortly to the balance of the AIM payment in the second quarter. If you recall, we made the first payment in December, and we'll make our second payment in May to balance out that first year. And then we'll also be making a $356,994 contribution to the recently created Hospital Distressed Fund. So that will be our appropriation at this point. That's the information that we know. So those are all going to have impacts as they aren't budgeted appropriations at this point. Are there questions? I covered a lot of ground. I didn't want to spend a great deal of time on the first quarter, as I think we'll be spending a great deal of time on the second and third.
Any questions for Ruth? I have one. Ruth, on the AIM, what is that amount of money that'll have to be sent in? What's the balance for May?
I will have to pull that for you. I know the total was $1,056,000. I believe the heavier portion of it, about $600,000, but I can follow up on that and send you the exact amount.
The other question I have, I understand the overtime in public health because of the COVID. What about
Yes.
services? Where's the overtime coming from there?
Well, we have caseworkers on call as well as supervisors on call as of last year or the year before. And so they're seeing an increase in reports, and that requires them to respond off hours.
Okay, thank you. Does anyone else have any questions? Okay. All right. So Mrs. Curran, yes.
Yeah, sorry, Ruth, just a question about the hospital distress fund. Is that money that we have to set aside for our county hospitals, or is that money we have to set aside and it can be taken wherever in the state that it needs to go?
My understanding at the current time is that the fund total is $250 million, $50 million to be collected from counties, and that's the amount that's attributed to St. Lawrence County, and $200 million to be used or to be collected from New York City. I don't know that it's necessarily dedicated to hospitals in St. Lawrence County, but we can certainly pose that question.
Wonderful. Okay.
And the only follow-up I have is next month at Finance, we'll bring you the 2019 draft results for the audit from Drescher and Malecki. And I would like, if possible, to have a meeting scheduled, the Fiscal Stability Committee prior to that to go over those results.
Okay. Any questions?
Okay, and then.
I'm sorry, go ahead.
That's okay. I just had a couple other items if there's not any questions on the quarter.
No, go ahead.
Okay. I just want to give you a quick COVID update. Dr. Williams and Dana will both be present next week for the board meeting to give you an update. There's been a lot of activity over the weekend. We are delivering this week our second round of masks shared out tomorrow, both the standard procedure masks that we have, as well as the cloth masks that have been provided. And if you hadn't seen the update, there is one additional case today, bringing St. Lawrence County total to 176, with 9 in hospital currently. I did mention the use of the One Stop Career Center for contact tracing. We're working with IT to use, if you're familiar, those conference spaces so that we can socially distance folks. Right now we can accommodate about 10, and I put out a request to county employees, and I'm happy to say we're already past 10 who are willing to be of assistance to public health. So as you can imagine, with these 176, some cases have more than 50 contacts per case. So that is very taxing and requires, I think, a lot of manpower to be able to get those calls made and contacts established. So we'll be working on that. Just a quick update on the New York State total. If you hadn't heard today, the numbers seem to be lower, with new cases of 3,951 for a total for New York State now of 291,996. They report over 825,000 tests conducted in the state, and they're seeing their 14th day of a decrease in hospitalizations, with currently 12,819 people in hospital. I also just wanted to mention that today, the crematorium in Oswegatchie was able to assist in meeting the needs of downstate, so that was put into service. Among the current challenges faced by the department are the essential worker definition and designation, proper documentation, and certainly the nursing homes. They have been cooperative in conversations and with testing. So my hope is that we'll be able to bring you more information next week from the experts. And we remain at two confirmed cases within county government that we have not seen an increase in the last week. You did receive the flooding update that I provided to you by email over the weekend. And unless there's concerns, I'll continue to share information that way. It seems to be one of the more positive pieces of information that we may be high, but it doesn't look like we're going to see another 2019 at this point. Also, we'll be moving forward with our new website. We have a tentative rollout date of June 1st. We will begin training our department level staff this week so that they can use the month of May to update their pages, get accurate information before we go live. Additionally, we're going to work on rolling out an intranet, and how that will look is on the back side of our intranet will be a login for employees and certainly legislators to gather information poignant to county staff. So we haven't had that ability before now, and our interest before is, we would use a shared server in countywide forms. We want to centralize all of that and be able to communicate with our employees, and certainly have them share pictures and information, and really have it as a hub for all county for our staff. So I did mention the fiscal stability meeting. I think those are going to have to become more frequent if possible, as well as I'd like to look at establishing a county recovery work group. And I don't dedicate that specifically to economics because I think it's just as important to look at healthcare as well as public safety. So I think all three of those areas need attention in the interest and the multiple conversations going on many fronts about some type of reopening. So I think that would be important as well if the chair would oblige, having a couple legislators work with us. And I would just draw your attention to an email sent out today from Treasurer Cole. I don't know if she wants to speak to that. She's here with us tonight as well. If there's any questions, that's all I've got for now.
Renee, if you would, please.
There, can you hear me?
Yes.
Unmuted. All right. No, and I just wanted to give you a couple of updates. The first was just a reminder that I had sent out the first quarter sales tax results earlier this month. We were a little over 6% better than the same quarter last year. In case you hadn't spotted that in your email. You should have the standard bank rec summary on your Google Drives. That would be for the February, and we're just about done with the March, so I'm happy we're still on track with that. Another item I wanted to bring up was it's April, and this is when we receive our tobacco money. We received that money, that was actually split into two payments, the last one on the 21st of February. It was a little under 1.7 million. So it came in $216,000 higher than last year, which is good news. It's a little bit of good news, at least between that and the sales tax. Something I thought I'd share that with you. We also I worked with Moody's last week. They did an update on our credit and issuer comment report. They issued that on Friday. That's basically provides investors with current economic and financial information, and there was no change to our rating. It is same as last year. We had the upgrade to an A3 positive. And lastly, I did send an email out to the legislators today regarding a change this year. I think that might have been overlooked with all of all of this COVID business that has kind of taken up all of our attention. But there's been a change this year. I'm kind of actually surprised. I think that the state's rolling that out right now. But it's beginning this year. Property owners with property tax delinquencies greater than 1 year are not eligible for the basic STAR exemption or the basic STAR credit. So they've requested the treasurer's officers to list of the taxpayers that meet that criteria. So it would be basically for 2019 taxes that remain unpaid, and we had to work with our tax software provider to get this. Right now, that list is looking like about 826 parcels. But after we turn this into them, the state has to determine who, not all of them are going to have that STAR credit, the basic STAR credit on it. But there's a timeline in the email that I rolled out to you. We will send this on May 6th. And on May 22nd, the tax department, the New York State Tax Department, will be notifying the delinquent homeowners who received that credit that they must pay their taxes in full within 30 days or they'll lose that STAR benefit. So I expect there's going to be a lot of phone calls in our office when people start receiving letters from New York State. Really, it's not anything that we are in charge of. So just wanted to give you a heads up because I'm sure that you will get a question somewhere along the way about it.
Any questions for Renee? Renee, do you have an idea of what kind of money that we were talking about that the constituents won't be getting?
You know what? That's probably maybe Bruce. I don't know if he's on. He might know what the basic star credit is. I thought for some reason I thought it was like, I don't even want to say.
Okay.
I don't know right off the top of my head. It's because they're over a year and delinquent.
We do have Bruce. Bruce. Are you there? Can you answer that question?
Yes, I am. Yes, Kevin, the basic star depending on the town, but it's usually in the $300 to $350 range, $300 to $350 per household with a basic star. Enhanced stars, that's a little bit more, but that's what we're looking at for the basic star.
Okay. So then you would just multiply by that those that have not paid their 2019 taxes then. So we will be getting some calls, I would expect then.
Yes.
They get this letter out of the blue, I think, because it's not widely publicized, I don't think. I don't know that, I'm not saying it's intentional. I'm just saying there's so many other things going on. This just kind of surprised us. We just found out about it like 2 weeks ago ourselves. So.
Okay. And does this come out of the Department of Taxation or where does it come from?
I believe it's part of the budget this year.
Part of the budget. So it's brand new. Okay.
Yeah.
Does anyone have any questions for Mr. Green or Ms. Cole? Okay, seeing none. Thank you both. We're going to move on to committee reports. First one is the Board of Health. Basically, the interesting part about this COVID is that all the cases are connected. It's not like you're going into Walmart and you're picking it up or any other store. All the cases have where they either caught it from a family member or somebody directly that they know. Question I had was, we have 8 students at the colleges that actually have tested positive, but all of their connections have been primarily related to the university or the college. So we have, Dr. Williams was hesitant to say that it has not spread out through the community from them because he was quite adamant that all the connections are there for the COVIDs. He did mention that one restaurant/bar was responsible for 30 to 40 of these cases. He did not say who they were, but all this is primarily before the pause was implemented. And I think Dr. Williams said the last time, starts out with international travelers, family connections, restaurants and bars before the pause, and then now in our health care workers. Dr. Healy expressed concerns about how healthcare workers are not being required to be tested. He did have some choice words to say about the Department of Health, because of course, and I think Dr. Healy is responsible for Maplewood. I don't know about any others. So he expressed his concern about that. And of course, now we have some cases. One of the things that Dr. Healy also expressed, that something that we should be concerned about, is we have people that are living on the edge independently now, that the slightest thing could actually cause a problem. They'll end up in the hospital. And then when they end up in the hospital, they're really not going to be able to return to the independent living environment where we had before. I mentioned the United Helpers facility there that the county had made arrangements for. That would not be suitable at this time because they wouldn't be able to provide medical assistance. So he was looking at a facility that was not open or something in Rensselaer Falls, but with Matt Denner, we kind of tracked it down that they're both, I think the IRAs is what they call them, they're both being occupied. So Dr. Healy didn't talk about what that facility was in Rensselaer Falls. That's Mr. Lightfoot's district. He's went up and down every street and he is not aware of it. But it's something that may come into the future. We're not at our peak yet. And so we expect more cases. He said we're about 6 weeks behind New York City. Because of their experience, we were able to get a leg up on it. And so even though we are experiencing more cases than Jefferson County. So that's pretty much it for the Board of Health. Community services, we primarily talked about the methadone. To answer Mr. Burke's question about increasing needs for mental health, the county, they themselves have not been receiving additional calls from like suicide lines or anything like that, John. We do not have a waiting list. And it does look like from the numbers that were presented to us by Jay at our last meeting that the telemedicine or telecommunications seems to be working. It's not the face-to-face, but at least so in addressing your question, Mr. Burke, at least on the face value, we're not getting those calls. So next up, Ms. Cornell Cooperative Extension, Mr. Denisha. Do you have anything to report, sir?
Thank you, Mr. Chairman. We did have a Zoom meeting on Tuesday, April 21st. And I guess the biggest things we talked about, the Cornell Cooperative Extension is on pretty good financial footing right now as compared to where we were last year at this time. But the couple of the big unknowns are the farm day camp this summer and Camp Overlook. Obviously, we don't know where that's going to go. So that could be a significant loss, if we're not able to have the farm day camp or Camp Overlook. But yeah, that's all I have.
Thank you, Mr. Denisha. Fish and Wildlife Management Board, Ms. Curran.
Hi. We have not had an additional meeting. In fact, I've written to them to see what they're planning on doing about meeting, and I've not heard back from Walt Paul yet.
Okay, thank you, Ms. Curran. Next up is Fisheries Advisory Board, Ms. Terminelli.
We have not had a meeting.
Okay, thank you, Nicole. Governor Fair Board, Mr. Leader.
Thank you, Mr. Chairman. There's been no meeting since my last report to the board. I believe there will be a meeting next month. I anticipate they'll have to address some difficult decisions with regard to upcoming events, and I'll certainly report if you don't hear it first in the media.
Thank you, Mr. Leader. Highway and Solid Waste Committee, Mr. Denisha.
I have nothing to report, Mr. Chairman.
Thank you, Mr. Denisha. The Industrial Development Agency, IDA, Mr. Reagan.
Mr. Chair, last week we sent out a copy of the IDA's report to all the board members to make them aware of what the IDA is doing during this crisis. Just to point out some of the highlights, the IDA has been contacting a lot of the companies to offer its assistance and advice in walking them through the payroll protection program and the CARES program, and also making them aware of the IDA's own loan packages and regional loan packages to get them through until the federal assistance comes in. They've also had a dozen companies who took advantage of the IDA's offer of a 3-month moratorium on loan payments, and another dozen companies have taken advantage of a similar loan moratorium offered by the IDA's regional partners that the IDA helped develop in place. They moved ahead with closing a loan with Structural Wood, and they're owning companies around the county, offering their assistance and helping them to understand what programs are available, how they fit into it, what they can expect, what other companies have experienced. And again, if any of you have companies that you want the IDA to talk to, please give the IDA a call and give them the contact information, and the staff member will give them a call and see what can be done to help them out.
Thank you, Mr. Reagan. Next up is Recreational and Trails Advisory Board, Mr. Arquette.
Thanks, Kevin. Before I start my report for the advisory board, Trails Advisory Board, I just wanted to dovetail off some of Mr. Reagan's comments. I had a number of small businesses in my district that were very panicky early on and were having trouble getting through some of the application processes. And I reached out to Patrick and his team, and they literally reached out to these businesses in a very short period of time and did everything they could to assist them through the process. So I thank Patrick and the IDA for that. Regarding the Trails Advisory Board, Deb and her group of volunteers are on the ground working hard in the trenches to get the trail system ready for a grand opening on May 15th. Although we certainly have concerns in and around where we will be as a state in regards to doing things or opening things that are recreational, but we will be prepared if we get the green light. Thank you.
Thank you. Thanks for reaching out for your businesses there, Tony, to the IDA. Next up, the RVRDA, St. Lawrence River Valley Development Agency, Mr. Forsyth.
Yeah, once again, Mr. Reagan's a tough act to follow. No real news with the RVRDA. We haven't had a meeting in 2 months, so he took all the wind out of my sail. So we're all set.
Thank you, Mr. Forsyth. St. Lawrence County Chamber of Commerce, Ms. Arquette.
Yes, we have also not had a meeting, but I've remained in contact with Brooke, and I just would like to give a quick update if that's okay.
Certainly.
So at the Chamber of Commerce, the staff are all working full time at this point. Sue is in the office managing all of the paperwork, health insurance, etc., and everyone else is working from home remotely. If you're not aware, St. Lawrence, the Chamber of Commerce has launched a takeout and curbside page at the visitstlc.com website. This has been very helpful to local businesses and to people around the community to connect them with the restaurants that are still open, to let them know their hours. It connects them to their menus, trying to give some support to some of the businesses that are being affected during the COVID pandemic. They're also continuing to work very closely with the IDA and with the SBDC to contact businesses and connect them with the resources and that they may need. And also they're hosting learning and informational opportunities. Just an initiative that they're working on right now. Brooke and Deb are working on developing 2 trail challenges right now. One will be a grade 8 waterfall crawl, and the second will be a grade 8 river ramble with a focus on easy trails that go along all 5 major rivers throughout the county. Deb and Brooke are currently working with property owners to confirm the participation and interest. And then Johnny and Brooke have been engaging event coordinators in conversations regarding plans for the summer, including the fishing, arts, and other recreation tournaments. The Market New York grant was set to support 8 of the fishing tournaments this summer with event production and marketing. Status with each of the communities is being discussed for these events, as well as possibilities for refurbishing or reformatting. Any guidance from the county or assistance that we can give them on how to on permitting or how to safely carry on with any of these events, they would be greatly appreciated. And the New York Market grant is available for use for this summer or for next summer. An updated schedule will be announced within the next few weeks as decisions are needed to made soon for marketing or production reservations.
Okay.
And that's it.
Thank you very much. John, Soil and Water, Mr. Burke.
We don't have a meeting in April, and we had reported on the last meeting, Kevin, so we'll have to wait till next month to get any news.
Okay, thank you, Mr. Burke. So moving on to old and new business, we do have a resolution. The resolution accepting donations for the Emergency Operations Center, the EOC. Ruth is shuffling papers. You must have a microphone, Ruth, on your papers or something.
Sorry.
Let me start again. So the resolution is accepting donations for Emergency Operations Center, the EOC, during the coronavirus pandemic and modifying the 2020 budget for the Board of Legislators. Moved by Ms. Curran, second by Mr. Lightfoot, Mr. Rinelli, Mr. Burke, Mr. Arquette. Okay. Who would like to discuss? Any discussion?
I can speak to this, Kevin.
Okay, thank you.
So we received a very generous donation in the form of a check from Mr. Edward Knight of Colton. So we'd like to recognize that in the budget. In the event, we can use that to support the operations of the Emergency Operations Center. The challenge with the Emergency Operations Center, as you know, we've been operational since March 16th, and it's for an indefinite period of time. So in most of these events, we set up the EOC, we run the EOC for the storm event or the response time, and then we debrief and we return. This is going on week 7 of manning this operation. So it'd be nice to be able to use those appropriations as we need to. Also, this resolution is recognizing the variety of donations we received, the generosity of St. Lawrence County folks, and really letting folks know how much we appreciate all of their donations, all of their donated labor to make masks, as well as to bring them over. We tried at first to capture the folks coming in and get a name and address so that I could write them a thank you note, but there are too many, and many of them don't want their name shared. They just want to be anonymous, and leave those with us and make sure they get put to good use. So we're very grateful for the generosity of the North Country folks, and certainly want to recognize the funds received as well as their efforts.
Okay, any discussion? So if we don't want to send a thank you to Mr. Knight, or because you have to send them for everyone, or like people don't want to be recognized, Ruth?
I have already sent one to Mr. Knight.
Okay, thank you very much. So all those in favor of the resolution signify by saying aye.
Aye. Aye.
Opposed, motion carried. Any other old or new business? One of the things I
Mr.
forgot to
Chairman?
mention. Yes, I'm sorry, go ahead.
Before we go into executive session, I would like to share something, but go ahead.
Oh, I was remiss in that during my public health committee meeting, Dr. Williams really expressed extreme gratitude for public health and the effort that Dana and her team have made. It is much like an iceberg. The public sees the map, and which has been very helpful in the daily news releases about the cases and stuff. I think that's been instrumental in helping keep the public informed and actually being aware and actually complying to a certain extent with the pause. And 90% of the work that they're doing, we don't see. It takes a lot of time to get a hold of all these connections. Like if somebody who's got the COVID, I know some of the students had anywhere between 5 and 50 contacts. So all that work is going under the table that we don't see. So Dr. Williams wanted me to express his thanks and gratitude to the Public Health Department for the work that they're doing. So that's all I forgot to mention that. Mr. Forsyth has something. Dave?
Well, it's regarding the public health, Kevin. Has anyone found out a correlation? I looked at the map today. St. Lawrence County has more cases than the neighboring 6 counties. Has anyone found out a correlation? And the United States has almost 40% of all the cases. And there's over 180 countries with it. Has anyone figured out why we're so inundated?
The only thing that I can tell you is that that Dr. Williams mentioned, because we asked the same question, was that he attributes to testing. Now, Jefferson County has a couple thousand more people than what we have, and their testing is comparable to ours. So I don't know the answer. Maybe Ms. Curran does. Would you like to add something, Rita?
I know that in Franklin, Essex, Clinton, and whatever, Hamilton, they're basically testing the people that are hospitalized or that they present to the ER in distress and they think they're going to have to hospitalize them. In Franklin County, they're simply looking at people, and if they look sick, they look like they might have COVID, they call them a probable COVID and they don't bother to test them. So you can only report out the numbers that you actually have a positive, nasal swab on, but they just are only really getting involved in people if they're critical.
So it's not really consistent testing, probably.
No, because I talked to the
It
lady.
just sticks out. It just, yeah.
I talked to the lady that runs the Department of Health and not runs, but she's kind of the head of the person deciding who does the testing. She said they're going by the World Health Organization plan and definition. And I know we're run by the CDC, and one would think we would all follow the CDC rules, but they like the World Health Organization better because all you have to do is look like you have COVID and you call it COVID. Not really scientific.
So I know that Dr. Williams, he reported when he was talking about the testing that in Franklin County, as of last Tuesday, they had only done 239 tests. And I think the map shows that they have 13 COVID. So, Mr. Burke, John, you had your hand up. Would you like to make a comment?
Well, actually, I think it's more of a question. I thought we all had to follow the guidelines handed down by New York State's Public Health Department. I assume it's correlated with the CDC, but I guess I just wonder, how do you ever assess our situation in comparison with others if you don't have the same guidelines for reporting and testing?
Yeah, I can't answer that. Mr. Lightfoot, your thing lit up. Anybody else have a comment they'd like to make? Ms. Curran?
Kevin, yeah. You can't really compare it because they're not testing. Like what we're doing in St. Lawrence County is if we have a positive, we're hunting down the people that they were in contact with. And for the most part, they're testing those people. So that's why you're seeing now, if anybody has any symptoms, they're tested. I've talked to the lady at the Department of Health in Franklin County. I've talked to one of the legislators in Franklin County. Part of the legislature, they don't agree with the way that they're doing it, but you can't compare our stats in St. Lawrence County to the counties that aren't doing the testing the way that it's prescribed by the CDC. So it looks like we have a lot. They probably have just as many as we have, and they'll probably end up having more than we'll have because they're not doing anything to figure out who the people are that have it and containing it. You may see that they get a great big bubble later.
Okay, anyone else? Okay, let's move on. Ruth, you had something you would like to add?
I do, Kevin, before we go into executive session, I just wanted to take a few minutes, ask you to oblige me in sharing with you, now that you're not coming into the office, I think, on occasion you come in for a certain purpose, but for the most part, you're not coming in. And many times when you would come in, you would be stopping in another department or meeting in another department, and that's all stopped now. So for a variety of reasons, I asked our staff countywide to share either a short video or pictures with us so that I could share both with you and with the public how we've transformed our work environment over the last few weeks. So if you want to stretch your legs or take a moment, I would like to have Dylan share with you. It's just a couple of short videos, about 3 minutes each, if you wouldn't mind.
Hello, everyone. It's Sheriff County Sheriff's Office. I want to thank all the citizens of St. Lawrence County for following directives out there to keep everybody safe. I also want to send a special shout out to the Sheriff's Office, our 3 divisions, corrections, road patrol, awesome and professional job. Please follow the directives, stay the court, and everybody stay safe out there.
Hi, for those of you who don't know me, my name is Kelly and I work in the Board of Legislators office. I myself am pretty proud of our county and my co-workers. During this difficult time, we can either use it to be worried and negative, or we can rise above and believe this change to our daily life is just temporary. It's just a pause.
At first, this new normal was like this haircut I've been forced to give myself.
Didn't know what I was doing, but I worked my way through it. Excited about the advances we've made since and the better ways to serve the public we're going to take with us through this when we can finally return to normal.
Hey there, everyone. For those of you that don't know me, I'm a caseworker in Children's Services, and I just wanted to give a shout out for all of my coworkers who are continuing to make home visits and support one another through this difficult time to make sure that our children and families of the counties are safe.
Office of Emergency Services COVID-19 impact. We are manning the County Emergency Operations Center 7 days a week. We're operating our 911 dispatch and backup locations to keep the social distancing requirements. Our deputy coordinators are working hard at processing and distributing all the PPE.
Bear with us, there's one more.
You can see that while our workers may not be here in person, they're always here in spirit. The spaces are a little empty, but in our hearts, everybody's here. And no matter what, we're here to take care of all of you.
And nutrition, and they are business as usual, but actually busier. They are delivering to all of the congregate residents. We're trying to get all of our home delivered clients 2 weeks worth of frozen meals, so any chance we get, we do frozen meals up, and that's what we're doing right now.
This is Danielle Durant. I'm the Meals Program Manager here at the Office for the Aging. And as you can tell by the looks of my desk, work life has been a bit chaotic and challenged this pandemic, but we're getting through it. We're getting the job done, and we're working really hard as a team to make sure the elderly are getting their meals.
The Office for the Aging. These are some of the meal boxes we're putting together for the elderly. So far, we're up to 184, I believe, and still going.
Cats that we have that we are giving out to our elderly on our ISAP program and home delivered meal program to combat loneliness and isolation. It is interactive, purrs, and vibrates, and is enjoyed by a lot of our elders.
My name's Christiana, and I work at the Office for the Aging. I've been fortunate to be able to stay home the last few weeks. My program includes information and assistance.
I've been working from home for 4 weeks now. It is getting easier, but it's definitely been a challenge, and I do miss my coworkers. This is my desk and my new office chair, and these are my new coworkers.
home office with the essentials, coffee, earpods, because my coworkers drive me crazy. We got a computer, all of our files, and busy coworkers. Keep safe, everybody.
Wonderful COVID times. I want some Fireball. Got my Fireball. Here's the Fireball dog. Wiggle, 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 wiggle.
Well, there you have it. A short video to let you know St. Lawrence County employees are hard at work trying to make the best of the situation in our new circumstances. So thank you. We'll continue to share the videos as we receive them. We've got more work to do.
Very nice.
Yeah, really nice.
Thank you.
Absolutely. That's all I have. And we
Is
do
that
need
Dylan?
all 4 categories.
Was that Dylan Soper on the acoustic guitar?
Tony had something.
Okay.
Oh, I think Tony's got his hand up, Kevin.
I'm sorry. Go ahead, Tony.
No, hey, Kevin and the group, I just wanted to report that I stopped in somewhat unexpectedly today to the EOC, and, everybody was there working hard. Very gratifying to see, and those types of videos, they're heartwarming and make us all appreciate the wonderful staff that we have working for the county, and I'm so appreciative of that. Thank you.
Very nice. Thank you very much, Ruth. I mean, that was great to see.
John has his hand up too, Kevin.
Oh, I'm sorry. John, go ahead.
Well, echo Tony's comments, but I wanted to ask, what are the next steps in the methadone clinic discussion? If memory serves me right, we have a deadline sometime in May for applying for a grant. And I think it's a big grant, or at least I thought it was. But anyways, if somebody could tell me what are the next steps in the process of deciding if we want to have a methadone clinic, and then who should run it.
So I think, and I think Ruth can add to this. I know I can remember from the last meeting, I think it was a May 21st or 23rd deadline. And I think work has been done towards that application. And that money is a federal. The SOAR money, I think, was $260,000, which is about the amount of money that Credo had received to start their clinic. So I think what Ruth had asked at the last meeting was that efforts to complete the federal application would continue. But Ruth, could you give us an update, or maybe Jay?
As far as the deadline goes, the deadline is May 21st. I think the board did agree to move forward with the work continuing on the application. I think getting the information through the presentation, the interest that Jay had was prompting whether the board was prepared to move forward. Now, the separate funding level, so that May 21st deadline is for $900,000 access at the federal level for that amount of money for clinic purposes. The second pot that he had spoken of was $250,000, and that's the SOAR money that has to be used by September. So those were the two areas of being able to have startup money. There were two questions that I think Jay was looking into last I knew, which was if the application were to be submitted, was there any flexibility on the federal level for the part regarding who would operate the clinic function? So the county potentially could say they want to do it, but they have to go through the competitive process to determine who would provide that should the county not be determined that they want to run it yet. Jay, did you want to speak to that any further?
No, I mean, we do have the $250,000 for the SOAR that Oasis is willing to kind of give some leniency in terms of its use. An opioid treatment program was not what the SOAR monies were originally intended for, but the county does have that as an option. $50,000, approximately $50,000 of that money, if we were to do as a county, would go towards a dispensing machine, a safe, the bulletproof glass that John had referred to. Also software for the dispensing equipment, a 30-day supply of medication in the security system. And they are also allowing us to use the remainder of those SOAR monies, approximately $200,000 towards the purchase of a new electronic health record. I also talked to Oasis today. There's also a possibility, depending on how, the board chooses to configure our current operations. If we were to transition some of the satellites into the main PRUs, there would also be a possibility of using the existing state aid monies that we're currently getting. We are getting about approximately $70,000 in state aid for Ogdensburg, and approximately $134,300 for Hampton. So there may be a way to use some of those state aid monies in efforts to start an opioid treatment program by the county. And then additionally, we have up to a $900,000 grant for substance abuse services, increase of substance abuse services. 30% of that would be designated or could be designated towards recovery housing, which would be a little different project. And that would probably be someone we have to look at it downstream, possibly a current downstream provider that's already providing housing within the community to take on that.
Okay. John, you have a question, Mr. Burke?
Just a quick question to Jay, if you don't mind, Kevin. If we created a methadone clinic, do you think this would bring us closer to being revenue neutral for community services? As we look at the broad picture of community services, I know it's been a struggle to bring the revenues up to where the costs are, but do you think this would help, Jay?
Well, I mean, that is the assumption not only by myself, but also by Oasis, who's encouraging us to get into the OTP because they feel, given the history of other people operating that service, that it would offset some accounting costs. So I would say yes, that is the intention and the hope.
Mm-hmm.
So I guess if no one else has any comments right now, I think the first thing that before we get into this more in depth is what is the consensus of the board as to whether or not we need a methadone or want a methadone clinic in St. Lawrence County. Right now you have one in Watertown and you have one in Plattsburgh. So Miss Curran.
I think that when you get them that close together, you have the same thing that you have with other drug treatment facilities here. They just go they have more ability to go clinic to clinic when they don't get the things that they want. And I don't know that we have that many patients that need it here in this county. I know that a lot of people will say, well, they don't really seem to be doing well on the, the Suboxone, or they want Subutex so they can still use while they, are on the medication. But I don't think that a methadone program is what we need here in St. Lawrence County.
Okay. Anyone else? Mr. Perkins.
Yes, I think Jay spoke to that earlier, that there was 500 people that are in need of this treatment, if I'm not mistaken, Jay?
Well, we have approximately 500 people receiving MAT, that being Suboxone and or Vivitrol. So if the county has 78% of the 84 MAT patients that would need a higher level of care, I would estimate that maybe 50% from the other providers, would maybe boost the numbers up towards 200 people. Since 2015, there has been 41 individuals in St. Lawrence County that have either traveled to Clinton, Jefferson, or Onondaga. Some even go to Syracuse. That's 41, including St. Lawrence and Franklin County, 18 from St. Lawrence, 23 from Franklin County, that are going as far as New York City for this treatment.
Okay, John, do you have a question, Mr. Burke?
Well,
Or comment?
Maybe a comment, Kevin. Oasis has been lobbying, I believe, and correct me if I'm wrong, Jay. Oasis has been lobbying the county to have a methadone clinic, and again, like Rick pointed out, the numbers certainly are there for the county to have a sufficient number to run the clinic. And I guess I think my opinion, we're missing out on something for the people that really need this service if we don't embrace it in one form or another.
Thank you, John. Ms. Harquette. Nancy?
Yeah. Jay, do you think that there would be more people that would benefit from this clinic? People that maybe don't have the ability to travel, and so they're not utilizing this?
I would certainly say so. I think the people that are traveling, particularly the ones that are traveling longer distances, must have reached a period of a point of stability in their treatment that they're allowing to be able to take doses home rather than have to show up for daily dosing. One thing about methadone, it has a much shorter half-life than Suboxone. So somebody can, say, divert their Suboxone and not have it for 2, maybe 3 days and not go through withdrawals. People that are on methadone, if they don't take a daily dose, they will go through withdrawals the same day or the next day. So there's less likely chance that they're going to divert their methadone medication, unlike Suboxone.
Okay.
All right,
Thank
thank
you,
you.
Jay. Anyone else?
Yeah, Kevin.
Okay, Mr. Lightfoot.
Jay, is there some way to identify who those people are? I guess my own thought with regard to that would be, you're looking at a run-up period before you're operating at a level that is, optimal for the service that we would be providing if we had that. During that run-up period, how would one go about identifying those people that would be available to avail themselves of a clinic like that if we were to proceed with it? I don't see how you can do it and come up with some usable and good information between now and the due date on that grant. But I certainly don't think that we ought to stop the process. I think it's something that if we reach a point where we can't justify the need in the county or in the area, then I think it would be foolish to proceed. But that being said, I think we've got an obligation to see what the need is. And I don't have an easy answer on how to do that.
Well, I mean, I don't know if you want to call it anecdotally, but we've reached out to, the Oasis providers in this county, including the tribe in Franklin County. And there's not one provider in those 2 counties, and including the tribe, that are not supportive of establishing an OTP. So, anecdotally, and I don't have that in front of me now, we asked them, how many patients would you have in need of a higher level of service, in the more immediate future. And they all either said, 20, a dozen, 25, that they could readily identify as needing this higher level of care. The other thing, the biggest unknown would be location, and the space. But in terms of the staffing, we have a brand new medical director for the addictions clinics right now. She's aware that we're looking at this and is excited about this. She does work full time for SLOTC on St. Lawrence Psychiatric Grounds. So, but, you know, I think, you know, she may try to you know, to fill in that gap that we need as a medical director. Then it would be a matter of probably trying to find, you know, a nurse practitioner or even a PA to prescribe the methadone and Suboxone. But in terms of our clinical staff, unlike some of the other programs, you know, we have all credentialed KSAC or KSAC-Ts, which cannot be said of all the other surrounding programs. So in terms of expertise, you know, it's not like, you know, we're going to have to be beating the streets high and low to be bringing, you know, some ringer in from the outside to make this happen. We have the staff. You know, as the program grows, we would initially, you know, use the staff that we have. I mean, certainly, you know, if you look at the numbers, you know, we could spare some clinicians, you know, to provide workforce for the OTP clinic. Because we're having a kind of a flat referral base right now, and so that's reflective in the numbers. If we were to transition the satellite clinics and keep those via telemedicine, you know, we could still serve, you know, those community centers and municipalities as well. So I mean, there's a lot of different combinations and permutations that, you know, you could, you know, come up with in terms of how to make this work.
Okay, thank you, Jay. Mr. Forsyth, and then Mr. Reagan.
Jay, can you hear me?
Yes.
What is the makeup of Credo? Are they a state-run facility, private? I'm not familiar with it.
I believe they're a private nonprofit, yes.
Okay, so they're a private nonprofit. It seems like most of the conversations we've had over the last several years is that the competitiveness of our payroll. By the time we add fringe, retirement, all those things into the equation, it makes us non-competitive with private. Would you agree with that for the most part?
It makes it very difficult, yes. I mean, I use the expression a mile wide and a foot deep. You know, I mean, we have clinics spread out all over the place, but we don't have, you know, the revenue producing staff to support them.
Okay, and from the numbers from Mr. Wilson earlier, I'm thinking he said 12 to 15 to staff this facility.
Yeah.
You need 100 to really break even. Those were the numbers I heard earlier. I'd have no interest in having a county-run facility. I'll say that now and forever, I believe. I do believe there is a need in St. Lawrence County, but I wouldn't support us being the ones who are running it. And I'll go on record right now for that. But
okay. Thank you, Mr. Forsyth. Mr. Reagan.
I think, you know, it's important to keep in mind the fact that not too many years ago, we did not have the heroin epidemic that we're seeing today. You know, the numbers of the amounts of heroin that are being brought in to the county from elsewhere, you know, there wasn't a need for this kind of program, for this level of medically assisted treatment, because, you know, we had the more traditional problems. And what we've been seeing is because so many of the addicted are messing not only with heroin, but also in some cases with fentanyl and other mixes, we've been seeing a terrible, terrible rate of overdoses and deaths that have, I would suspect are, you know, we talked about COVID, the death rate amongst those who have gotten into heroin and opioids, you know, there's no comparison. So I think it's very important that we find a way to cope with this opioid epidemic and help get these people care that will help them eventually transition into a normal life. And working with agencies like St. Joseph's that have inpatient treatment, that have youth treatment, and have outpatient treatment, will help provide the kind of seamless and comprehensive care that is needed. Because our goal at the end of the day has to be to end these senseless deaths and to help these individuals cope with the problems that are facing them, that are facing their families, and that are frankly facing the rest of our communities as well. So I think it's imperative that we make the tough choices to provide this service to help get this problem under control. And I think that's what should be guiding us.
Thank you, Mr. Reagan. Anyone else? Mr. Burt.
I think it's important to keep in mind, who can best provide the service. In any other occasion when we are looking for competitors, we do an RFP, and we don't just take somebody because they happen to be knocking on our door. And again, no reflection about, as far as I'm concerned, about St. Joe's, but they're knocking on our door. That doesn't mean that they are necessarily the best ones to provide the service. Personally, I'd like to see Jay do a business plan to show, because we're not just talking about meeting the needs of a core group of individuals who have struggled and oftentimes aren't successful in their rehabilitation. We're talking about the whole overall services. If we can have a revenue producer that would offset the cost for all of community services, I think we owe it to the people we serve, to our employees, and certainly to the residents of the county. I'd ask for a business plan. Let's see what it would look like.
Okay, thank you, John. Rita?
So I just want to clarify one, if there is a true need for a methadone program, I agree with John. It should be put up to bid by somebody that is already doing this and can put it together. I don't think that you just, I've been having a lot of discussions lately with people in different places in the community. I've had a couple agencies that have said to me, I don't really think that's our need. We're having really good luck with the Sublocade injection. We still have a lot of people that drive out of town just to get Suboxone to New York City. And between Citizens Advocate, Potsdam Hospital, St. Joe's program in Messina, they've brought hundreds of people back to our county instead of making them drive to Syracuse, Albany, or New York City. So we've certainly answered that, but I don't see from the other agencies that I talk to, I don't see them saying, hey, we really need to get into methadone. We really have all these patients. What they're saying now to me is, we're putting these people from Suboxone onto the injectable 30-day Sublocade, and it works wonders for them. They don't necessarily like it at first because it's a real steady state instead of being up and down, but it's safer for them. You don't have overdoses on Suboxone because it's got the naloxone in it. You're not having people continue to overdose. You can still overdose on methadone. and still need a Narcan shot. So I just think that the Suboxone products and stuff is just safer. And not because I just prescribe that, I could prescribe both, but even the VA in Syracuse has really gotten away from putting anybody on methadone.
Mr. Burke, or go ahead, John.
Rita, that kind of flies in the face of what Jay just told us. He's been in contact with all the substance abuse providers in our area, and I think he said some in Franklin County, and they gave him ballpark numbers of the ones they thought would benefit from that, and they encouraged him to do it. Oasis, I mean, I believe me, Rita, I'm certainly no expert in this area whatsoever, but
and I don't know, and I'm happy to have that discussion with Jay privately and show him the text messages I have.
Mm-hmm.
I don't think here's the place to do that.
And the other part of that, Rita, and I'm sorry for talking to you directly, but the other part of that is Oasis. I mean, if I were just not knowing a lot about the ins and outs of the substance abuse field, I think we have to listen to the experts, and I think Oasis is a good source of information, as well as the frontline providers that Jay's talked to. So that's just my opinion.
Mr. Perkins. Thank you, John.
Thank you, Chairman. I think with the information that we've got, the timing, we should probably go forward, do the application for the money. Time while we're doing that, Jay could put some figures together, a business plan, whatever it is, to see if it's worthwhile for us to go into that type of a business, and we can make the decision as we're going through if it's something we want to do or not.
Okay, I think that's a good point, Mr. Perkins. I think I'll make some comments. I think there are some advantages to the methadone. I mean, the supply is daily. The half-life makes a difference. It's whether people are abusing it. And it seems like more and more people, there's a big history behind methadone. I mean, it's been going on forever. And the job displacement, the illness. So I think we still have to decide. I think we've got Ms. Curran that's against having a clinic, or maybe not the need. And so the first phase would be, the first question is, are we interested in having the methadone clinic in St. Lawrence County? And if there's any objection to that, right now, Rita, is anybody else against exploring a clinic? So I guess what would be the procedure? I'm sorry, Mr. Lightfoot, go ahead.
I think you're looking at it two different ways. Are we going to explore it, or do we want it? And I think, yes, I'd be in favor of exploring it, but okay, based on what I know right now, which is very little, I don't want it. So I think that hey, that's part of the process, is looking at facts, looking at data, and coming to a rational decision based on that data to see, hey, should we be doing this or should we not? And as far as a business plan, you can make a business plan look however you want it to look. I would think that looking at Kratos' business plan, if in fact they put one together, or some guidance from Oasis on what they would want to see, how they would want to see it run, who they want to see in place there. The question about security to these folks tonight got it got my attention when they're using their own civilian staff to do security along with hired help. And I guess that was probably one of the other questions that I would have gone to is, well, who did you hire and what experience do they have? And what experience does your professional staff have in handling people that are milling around outside your building, number one, or worse yet, inside your building? So there's a lot to be learned before we go hog wild into signing on the dotted line with Oasis.
So Ruth, would you have any suggestions on how we should proceed?
Well, the looming deadline is May 21st. Jay, did you find out anything from the funding agencies about any opportunity to amend the plan? If we were to either submit the plan or submit the grant application with another entity running it, we certainly don't have time to do a competitive process now, or amend it later if we did put the grant application in with the county being the operator.
No, I have not. I mean, I can, Heidi Ames from planning, she, much like me, did not find any of the contact information on the grant application. So we're going to have to probably go a different route to get some contact information.
Okay, so it would be nice, Kevin, if there is flexibility. I mean, I think you heard even in the Credo conversation about the challenges they're having right now with their operations. And, you know, we'd certainly be some months out from that clinic's doors opening. But I think if there's any flexibility in the grant application, it would be unfortunate to lose that amount of startup money if it is something the board would like to do. But I would think within, you know, the next 30 days, the board probably needs enough information to be able to identify that this is something you want to introduce to meet a need in the county, or at this time with these funds, that's not something that you'd like to move forward with. I think that's really, and we can work to find out what that information is and how that data can be presented. And I think if we look at, let me just pull up the calendar real quick. You know, we do have the flexibility to announce and hold a special board meeting prior to. You don't necessarily need board authorization for the submission of a grant application, as you all know. But I think, you know, the cart and the horse in the right order, you want to make the decision to move forward before that grant application went in, if it's possible. But also that SOAR money of the 250 can be reprogrammed if in fact that decision is made not to move forward. But I think that's also something that, you know, while it has a longer timeline, in the constraints we're living with right now, it might be a challenge as well. And that's September, as a reminder. So does that help at all? I mean, I think we can certainly work on some information to get to you. I just wanted to make, not reach that oversaturation point of valuable data to inform and allow you to make a determination. Well,
I think today, you know, tonight, you know, this discussion is kind of, we've got into the mechanics and the number of people to make the clinic and staffing and all that. So I still think the question is, philosophically, do you think that a methadone clinic is needed in St. Lawrence County? So I don't know whether Jay can get more numbers or something that would satisfy some of those. I believe from the information I've heard in the past presentations that we do. So I think we have to decide that rather than mechanics, even if you don't get the grant. I mean, I think the way to look at this is if you don't get the grant, I've got you, Mr. Reagan, just a second. Is even if you don't get the grant, is a clinic still needed? So from a public health standpoint. So I know with the Suboxone, just from some sources and just some limited information, that Suboxone is it's basically, it's being sold and traded for heroin. We had an inmate, I think, that was on Suboxone, and then he overdosed. They got him right 2 miles from my house. You know, the sheriff came along, the deputies, and they saved the guy. He had just been released from jails, traded the Suboxone for heroin, and was overdosing. So, you know, in all respects, you think that somebody who needed treatment, we would force them to be on Vivitrol. And I think Shana Smith basically said we have, I don't know, I think Jay, is it 12 individuals out of all that we have that are actually on Vivitrol, which is, with Vivitrol, you can't get high. So you still have individuals that still want to have some euphoria, you know, from their drug. And so the methadone provides that, but in a controlled environment. And as what I think the guy's name was Dr. Updike explained to us in the presentation, is that the physicality of the brain has changed, and that they're actually, in some regards, addicts for life. And so you need to treat it like diabetes. That kind of brought home to me. Mr. Reagan.
Thank you, Mr. Chairman. I just want to make it clear that I'm not pushing St. Joseph's over anyone else. I just think it's important that we as a board not rush into a decision, and that we, I think Jay should check with all the various agencies serving the county to see which ones are interested, and that, prior to, while we're waiting to do an RFP, that we hear from them and hear from them about what they see the need is, and give us a feeling for what their experiences are that would convince us to tap them for this new service in the county. And, there are a lot of different agencies in the county. There may be others that are interested in providing this service, and we should ask them, are they interested? And get them into the mix so that we can make an informed decision, and that, we're not rushed into something that takes our eye off the ball in terms of keeping the programs that we are running, having them be effective. I mean, it was just a year and a half ago that our clinics had a week to 10-day waiting list, and anyone who deals with addictions, when someone is ready for assistance, telling them it's going to be a week and a half before they see anyone, is counterproductive. And I think we need to be looking at how we can improve services and make them more comprehensive, and make sure that we are improving matters and reducing the overdose rate and the death rate in St. Lawrence County. And the way to do that is to talk to those who have the expertise, and who are on the front lines.
Thank you, Mr. Reagan. We have Mr. Fay and then Mr. Denisha.
I just add something that, if I heard it right at the very beginning, he said he was servicing 17 people at the present time from St. Lawrence County, but at the same time, he did not want anything to do with the clinic in St. Lawrence County. Did I misunderstand Mr. Wilson, or is that what he said?
They definitely had not thought about it. I think, Jay, could you speak to that? Credo has not ever looked at St. Lawrence County for expanding their operation, correct?
Not in any depth that I'm aware of. I think today he said, just in terms of the geographic challenge of putting a clinic somewhere in St. Lawrence County, far and away from where his current base is, would be somewhat contraindicated
for their organization. Yep.
Right.
Anything else, Mr. Fay?
No, I think we got to keep that in mind when we're considering this, though. And you've got an established clinic that basically has got 17 of our residents at the present time, doesn't want to come to St. Lawrence County. That sort of makes me nervous, put it that way.
Okay, thank you. Mr. Denisha.
Yeah, thank you, Mr. Chairman. And a lot of great comments, a lot of great questions, but it seems to me that we're getting very deep into the weeds. We're almost to the point where we're going to hire a contractor, and we don't know what we want the house to look like yet. So I would suggest that we let the professionals, which I don't believe is any of us, tell us whether we need a clinic or whether we don't, and let the data dictate where we go.
So there is another organization. Who is the organization in Plattsburgh, Jay, that's a for-profit entity that's actually doing a methadone treatment in Plattsburgh?
Conifer Park, I think.
Conifer Park, yes.
Conifer Park.
Conifer Park, you said?
Yes.
Mm-hmm.
Okay. So we could invite them in for a presentation also, if they were amenable to that. What's the
Or Jay,
flavor of the-
do you think that Oasis would have any interest in speaking with the board and providing information? I mean, they are not only providing funding to this end, but, obviously also let us know about the grant. Could you engage them to see if it's something that they could speak to with us? They wouldn't have to travel up here. They could join a Zoom meeting. Is that something you think you could inquire about?
I think it'd be valuable myself.
I mean, I can certainly ask, yes.
Okay, so we can let you all know if that's something that we could do and have them join our meeting.
Would Oasis have a projection of what they, based on their models of what the need is in St. Lawrence County? I mean, they're actually the ones that are encouraging the county to open one. Would they have some type of modeling or projections of what the actual need would be based on who we're actually treating now and who's going untreated?
Well, I don't know. I can ask that. I mean, these numbers that I spoke of, about 18 people from St. Lawrence and 23 from Franklin that are traveling longer distances for this type of treatment, was from Oasis.
Okay.
So I will follow up with Jay to talk about Oasis coming in, and we'll see if we can't get some more information.
Okay. So thank you, everyone. We'll move on to executive session. Ruth, do we have a need for all 4 categories?
We do.
Okay. So I would entertain a motion to go. It's an executive session, Mr. Forsythe, seconded by Mr. Lightfoot and Mr. Fay and Ms. Curran. Any discussion? All those in favor signify by saying aye.
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 Okay. Opposed? Okay, we're in executive session.